So.
All right, Dr. we're live.
Hey you guys, it's Dr. Emer. We're doing a great treatment today. Neurotoxin. You guys know what that means. That's using toxin on our guys to prevent some of these movement lines. So raise up a little bit, show them these deep wrinkles, squeeze in, relax, and then smile as big as you can. Show them in the pan. This is a great representation of the orbital muscle here. Relax a second, because this muscle goes all the way around to the corner of the eye, up from the brow. That's why you can do a chemical brow lift in some patients where when they smile again, see how it's pulling down on his eyebrow? You can actually do some of the toxin here, go ahead and relax, to lift the eyebrow up. However, in some guys, you gotta be really careful. You don't wanna lift the edge too much, because then it'll make him look more feminine unless you wanna look that way. It's your choice. And in the central area, squeeze in, relax. Also these little bunny lines on the nose, that's another area where when you treat the middle, if you don't also treat the nose a little bit, he's gonna have the wrinkles there, but not in the middle, and he's gonna notice them more. So we're gonna do kind of an area, we're gonna treat all the areas today. Be really careful because his brows are low and he has nice blue eyes. We don't want the eyebrows to cover, so we're gonna go really high on our injection and do a little bit laterally to prevent the elevation. So he has a nice horizontal improvement in the brow, in the forehead, a horizontal look to his brow arch, but it doesn't drop, okay? So squeeze in for me a second, relax. You're gonna feel a little bee sting. We're gonna go right into the central muscle here. Good. Just do a small amount. Relax, squeeze in again. Relax. So I'm grabbing the muscle, you guys, and going right into it. What are they saying, Jordan? Squeeze in.
Someone said they need it. Someone said he's perfect, don't touch him.
He is. But,
Someone said some other
like
stuff.
Some people like this for various reasons. One is prevention of the wrinkles. Two is sweating. Okay, what else can it do, you guys? Forehead. You got a whole crew over here. What else can it do?
Forehead.
Acne. Treat acne, right? If people get acne, especially girls that use a lot of products or guys that use a lot of products, they get acne up in the forehead. What's that called? Acne cosmetica. You can get rid of it with Botox or Dysport. Okay, squeeze in, or any of the toxins. Relax. We're grabbing that edge here. What's another thing that the toxins do to the skin?
Smooth it.
What?
Smooth.
No. What I'm talking about, like, we already know that medically. Like, what does else do? Migraines, very good. So we can go, when we go high, if you have migraines, and redness. Remember, it gets rid of rosacea and sensitivity. So also remember I said, in girls we tend to do a chemical brow lift, but since he has some deep wrinkles, we're gonna do a little on the edge over here as well, just to help his hooded brow, because we don't want it to come down too much.
So are you guys based in LA? Yes, we are, guys. Send us a DM, full name, email, phone number. Also, New York City and Boca Raton.
So now we're gonna go high, go ahead and raise. And you guys can see he has a U-shaped forehead, so that actually makes it a little easier. Go ahead and relax to treat. Does anyone know why? Because the middle frontalis, when it connects into a central arch like this, you actually don't need a lot of toxin there, very little. So you can do just like a very small amount.
Someone wants to know if you have consults here in Miami. Yes, guys, we do in Boca Raton, which is really close to Miami. So guys, send us a DM, full name, email, phone number, and we'll reach out to you.
Okay, so remember what I said. Relax.
Someone said Dr. Emer needs Botox.
I do. I do, but you know what? I like my wrinkles, so I'm okay without it. So what I do instead is I do all my lasers and peels. Lots
If
of
this is his first time, when will it kick in?
So you guys tell me, what have we taught you guys before?
This sport is 2 to 3.
Yeah, 2 or 3 days, but still 10 to 14. So Dysport and some of the other toxins may go a little more rapidly in terms of seeing the result. However, when we first did the clinical trials, we did half of our foreheads with Dysport and half of our foreheads with Botox, and at about 10 days, it was completely even. So even though one side may act a little faster, the results are still the same. So it just depends on your preference. Do you like Coke or do you like Pepsi? You guys have to decide, because it's your choice. They both do the same thing. All right, now let's go to the eye. So this is a good one, because the traditional approach for eye, you guys, is to do three points around his eye here, right outside the lateral canthus. Smile as big as you can. But he has wrinkles that come all the way down. Go ahead and relax.
What happens to the Botox over time in your body?
The Dysport doesn't go in the body. It only stays in the muscle, and it disappears over 3 months. So smile again. Relax. So we want to go a little lower And you're traditionally taught, smile again, relax, and we're gonna go a little closer to his eye so we get those wrinkles over there.
What color are Dr. Emer's eyes? OMG.
It's a good question, I won't tell you.
Now look.
Does anyone know?
Green.
Green.
And how do you know that? Less than 2% of the population has it, right? That's what I was taught the other day. So I'm unique.
Very rare.
Smile again, relax. We got light eyes today. Smile again, relax. And you see how we're going a little closer to the eye, which is fine as long as it's in the muscle. So that's it, you guys. Now, he may start to experience less movement in the forehead regardless of him wanting to still have movement. It's still gonna feel strange to him because he's never had it before. So over the next week or so, he's gonna notice the brows being asymmetrical as time goes on, but once 10 to 14 days kicks in, it should be really even, it should be smoother, and it should be a nice improvement with some movement still. All right, you guys, so that's Brotox. How did it feel?
Not bad.
All right,
It's
so
great.
we'll see now in 10 days how you think you look. Bye, guys.
Cool.